I'm Holly.
And I'm Patrick. I'm the pharmacy manager at Randall Mill Pharmacy.
January is Thyroid Awareness Month, and today we will be talking all things thyroid. Patrick, can you start us off by explaining where the thyroid gland is and what it does?
Sure, yeah. So the thyroid gland is a small butterfly-shaped gland that's at the front of your neck, very close to where your collarbones meet. And even though the thyroid gland is kind of small, it supports so many things throughout the body, including metabolism, digestion, breathing. That's just scratching the surface.
All right, so the thyroid gland, you can always remember that because it's butterfly shaped. That's pretty cool. So Patrick, what are some common thyroid disorders?
Okay, some common thyroid disorders can include something that's called a goiter. And a goiter is actually just the thyroid gland becoming enlarged. You may have heard of iodine before. It's something that the thyroid needs to function properly, and when you're not getting enough iodine, the thyroid gland will start to expand and get larger to try and trap as much iodine, that it can to ensure that it works properly. Mm-hmm. And another thyroid, disorder that can happen, that I think is actually the most common thyroid disorder, is something called hypothyroidism. Now, hypothyroidism is when the thyroid is not producing enough hormone. And so some side effects of hypothyroidism would be constipation, drowsiness, brittle fingernails, loss of hair, slow metabolism, so weight gain. So that's the low end of the thyroid spectrum. Mm-hmm. The opposite of that would be hyperthyroidism, and that means that the thyroid is producing too much hormone. So you're going to get the opposite side effect of low hormone. So when you have high thyroid hormone, you're going to have a high metabolism, so you're going to be very skinny. You're going to have trouble sleeping. Instead of constipation, you may have more diarrhea. So think about that. You want your thyroid to be in the middle. There's a good middle ground there, and the thyroid disorders tend to be at the end, low and high.
Mm-hmm. So the thyroid gland can really impact a person's life if it's not functioning properly. So if it's underactive, as in hypothyroidism, overactive, as in hyper, or in the case of a goiter, which can result from iodine deficiency. Patrick, do you mind talking about how they diagnose thyroid disorders?
Sure. Yeah, a doctor will usually diagnose a thyroid disorder using a physical exam, and the doctor will look for the signs and symptoms that we just talked about. Mm-hmm. But ultimately, the diagnosis will come through blood work and checking the actual thyroid hormone level. Now, if someone does have hypothyroidism, so low thyroid hormone, it's very common. In fact, the medication used to treat hypothyroidism is called levothyroxine, or that's one of the options, the most commonly used option. It's actually the number 2 drug currently on the top 200 drugs used. So, this is a pretty common disease state. A lot of people have this. Doctor will most often prescribe levothyroxine. That's what we see at the pharmacy, and it's usually taken once a day, every day, because you do want to supplement the thyroid hormone. It's involved with so much in the body. You want to make sure that you're taking that every single day. And the best practice is to take that first thing in the morning, at least 30 minutes before food, because food and sometimes other medicines and herbal supplements can all affect levothyroxine and how it's absorbed in your body. So just the best guidance is to take it at least 30 minutes to an hour before any other food, usually first thing in the morning.
Okay. So to recap, today we've discussed what the thyroid gland is, how it works, common disorders associated with the thyroid gland, as well as diagnosis and common treatment options and therapies available. If you want to learn more about anything we talked about in this video or have questions, please feel free to reach out to us on any one of our social media accounts, such as Facebook, Instagram, YouTube, and now TikTok. We also ask that you give our video a like and a share as well. Stay safe, stay well, and we'll see you next month.